Good morning, ladies and gentlemen. I'm here on behalf of the school with the support of the Dean of Makerere University School of Public Health, Professor Rhoda Wanyeze, and my chair, Dr. Elizabeth Ekirapa-Kiracho. I take this opportunity to introduce my colleague, Mr. Stephen Sendagere. He's an epidemiologist with Makerere University School of Public Health and Ministry of Health. He's currently deployed in African Union under CDC Africa in Addis Ababa. My colleague, Martha Akurume, she's an epidemiologist with Makerere University School of Public Health, but then also a researcher. The Makerere University School of Public Health is a member of the National Task Force of Ministry of Health. We contribute in the best way we can as frontline responders, but then also as trainers. We received guidelines from Ministry of Health and World Health Organization about getting workplaces ready for COVID-19. As a business, do you believe you should be worried about COVID-19? For the three main reasons that I shared. One, the fact that workplaces are potential places for amplification of COVID-19, because beyond the cases, as a system, you could get overwhelmed. I know that City Medicals, you're into occupational health, medical care, laboratory work, engineering, all sorts of ventures that contribute to health. Am I right? Yes. So in a way, one, it could be an issue of cases. You have to evacuate a case. You're running an EBS system, so you could actually get overwhelmed if you are the only person who has the system to support Kampala with evacuation. And then the fact that you are always managing crowds. We are here as a workplace, but then you have customers coming in and out every day. So that really speaks to the fact that we could be a breeding ground for an outbreak. You must prepare yourself as a business so that the employees are not affected, but then also you protect your customers, but then also to think about how do you maintain your suppliers and working with them. We want to sensitize about 400 organizations about what they need to do to protect their employees, customers, and businesses from the potential negative effect of COVID-19. So we think that if we do share and talk about this and provide a platform for learning and sharing, people can continuously start to think, what do we need to change? What do we need to do now in order to protect ourselves? As part of our mandate as Makerere University, but then also Makerere University School of Public Health, we do teaching, we do research, and we do community service. So as our community service, we are here, and we hope we can contribute in some way.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Now that we know what coronavirus is, currently in Uganda, as of 22nd March, we had our first confirmed case, the gentleman, the 36-year-old gentleman from Dubai. He was isolated in Entebbe Grade B hospital, and as of yesterday, I think by 9 p.m. on the news, he was still in stable condition. But then I think overnight, by, I don't know, I think before midnight, we have come to learn that now we have 8 new confirmed cases in Uganda, bring it to a total of 9. And these 8 were actually in the community. We have to step up our efforts as volunteers, as people who have trained as medical personnel. So we hope that everyone can be able to make their contribution, even you as people in the healthcare setting. If we are called upon to be volunteers, I hope you can actually be available. I want to give you an idea of how the outbreak looks like globally. So this is a dashboard from the coronavirus COVID-19 global cases by the Center of Systems and Science and Engineering at Johns Hopkins. So every day, like actually every minute and every second, they keep updating. I think it should be about 30 minutes, using data sources from WHO, CDC, ECDC, and try to see how many deaths do we have, how many are recovered, and the total number of countries affected. So currently, we are at 168 countries affected. So you may check that by evening it comes to 170. So we've been seeing it increase over time. And then around here on the far left, you have the confirmed cases by country, region, or territory. Okay, and I think they have organized them in descending order in terms of the confirmed cases, in terms of totality. And now at Uganda, let's see. Uganda, now we are at 9. As of yesterday when we checked, we were at 1. But now they've already updated the 8, and now the cumulative is 9. So you're able to see that way. It means if you want to travel, or if you have any client coming from a certain country, you're able to know as a workplace, where is this person coming from and what do we need to know in terms of risk. Okay, so that is one. But then this is accumulative cases. That is both the new, the old recovered together. But then you have what they call like the active cases down here. When you click here, it brings you active cases. And let's say you can zoom in and let's say you go into here, Uganda. And when you click Uganda, it will bring you here what Uganda is, that confirmed 9, deaths 0, recovered 0, existing 9. Here you can get to know the total deaths from the far right and then the total recovered. So of importance, you realize that actually much as there are so many cases, so many deaths, but then we have actually many people that have recovered. So in a sense, that gives you the confidence that if we do detect early, if we manage properly as within our healthcare settings, actually people can recover. And you can go into the details and even know the age groups of those recovering, the differences. What are your thoughts about our current risk and potential of negative impacts for COVID-19? As a person, but you can speak on behalf of your customers or on behalf of our business as here as City Medicals. What are your thoughts? Anybody has any thoughts that they want to share?
Maybe further, the issue is
supplying them. Okay. As a brand now, you're able to do more supplies because we need certain supplies provided. Thermometers, control our own temperature, monitor our own temperature, sanitizers. The people of sanitizers have gone into business. So there is all of that, being aware of all of that, but then thinking, okay, if I needed to strengthen my business, would it be even possible? Because you can't maybe get more supplies in. So you being aware about all of that is important, and that information about the current situation in Uganda, the current situation in the world, being aware about your neighbor. If you have a cargo coming through Kenya, you should be aware that it may take 4 more days, may come 4 days later than anticipated, because you know that the situation is not getting easier. If they decide to do a total lockdown in Kenya, it could actually be a problem. So that dashboard helps us with that.
From the epidemiological side of what is happening, I just wanted to make a little bit of a perspective.
Yes.
You see, in Uganda, we are waiting for patient 0. People who know a little bit of the biostatistics. Patient 0 is the first case confirmed.
Yes.
And you see, we have to think that coronavirus has been already in Uganda.
Yes.
But we are waiting for that patient 0 to see the numbers scaling up. And already you can see where we are heading to. Because you see, when you get the first case, you start tracing back. And the moment you start tracing back, trust me, you get numbers. Okay? So from the first case that was confirmed, you can see now we've reached 8. Now, interestingly, these 8 have been in the communities. Okay? Now, when you follow the 8, get into the communities, you're going to pick more numbers. What does that show? We are going to see a graph that is increasing.
Yeah.
Are we together?
Yep.
So in our mind, we should get prepared to see more and more numbers increasing in the next coming days, in the next coming weeks. Now, what does that mean to us as an organization? One, we have to be more vigilant. Okay? On a personal level, we have to be more vigilant. That means we have to practice everything that they are telling us, what the Ministry of Health is telling us, what the WHO is telling us, and what all these health organizations are telling us. On a personal level, as an organization, we are going to have more people flooding us as healthcare providers. Okay? Now, we are unfortunate as healthcare providers that people who come to us are people who already have some suspicion. We are not like a supermarket where normal people go to. Here, people who come to us are people who have some suspicion. So which means we are at a very high risk of seeing more cases coming to us. So as an institution, we need to have that in our mind. We need to be more vigilant. We need to see. I'm sure you're also going to talk a little bit more. This is a medical workplace.
Yes.
So if you're doing a workplace at another institution, if you are only watching CNN and social media and getting amused by what people are posting, it's now real.
It's now real.
We are now in theater.
As the word goes.
We are now
in theater.
So let it sink in our mind that we are now in theater. So everything that we do from here dynamics are changing.
Yeah.
Thank you so much.
Thank you so much. And I think from our leader, that is a very strong statement. It comes, everybody has a responsibility, if I should put it that way. So as we go through this learning together, try to position yourself as a person. What are you able to do and what is your responsibility in all of this? So I think at every point, every one of us will have to play their role. So I just want us to start getting into what we can do to prevent our workplaces from being grounds of COVID-19 amplification. Because you remember the 3 points that we discussed earlier, why we are targeting workplaces. There could be breeding grounds for the disease. The crowds, the customers we see, we spend time together, we are socializing. So it's a place that you could actually come to but live sick. Or it can be a place you come to when you're healthy and live when you're sick because a coworker infected you. There is that. But then it's also a place that you can use as an early warning system for detection of disease. As a workplace, but then also through the customers that we serve as a healthcare setting. But then also the importance of our workplace as a business, where we and how we thrive. Okay? So one of the most important things that I think that we have talked about is keeping your workplace clean and hygienic at all times. As in, maybe we have been doing it every day, but you wake up, the person who comes to cleans in the morning at 8 or at 7:30, and then they take out the trash, and then it's all good, okay, until the evening when they either come to clean at 5 or maybe if they clean in the morning, depending on your schedule. But now it's going to change. As an organization, it may mean that you may have to say that, you know what, after an hour, please go and disinfect the doorknobs, all the toilet handles, all the switches, the kitchen place should be cleaned every after 30 minutes. The reception person, you have to keep, I think, disinfecting your desk, because when we come and speak, hello, how are you? We are spitting droplets, and the droplets carry the virus, okay? And then it settles on there. So so like our receptionist is really at risk. Okay, so when we talk about workplace cleaning and hygiene, it's not the usual. Okay, so we've heard about this recommendation, but the most important point here, we are making the why and then what you need to do differently. Okay, so probably you had a schedule for your cleanup. Maybe after this meeting, if you have not already done it before, you may need to adjust it a bit and call the housekeeping crew, and you're like, you know what, now we are changing things. We are going to be cleaning thrice a day. It may help. It may help a bit. Okay, so what does that mean? Maybe you need to stock more disinfectant. You need to stock more soap. So it has a lot of implications, but be system-wide. It is not an issue of what job you're doing per se. We all have different risks, but for hand washing, everybody must wash their hands. IPC, infection prevention and control measures, have to be at their most. Okay, you always implement them if you're working in a lab, if you're a nurse, if you're manning the ambulance, you know all of this. But being aware that if you actually miss a step in doing it, you could walk away with disease. I think that sort of awareness is going to be very, very important. We're good? And also, of course, promoting respiratory hygiene. I think this is one of those that sometimes we get curious about. You can no longer cough in your palms. No, that won't work. We are talking about this. Coughing under your elbow. You need to manage your hands. And I think the president was so clear about this. You can actually touch the surface and you get the virus, and if you don't touch your face and the soft parts and you wash with water and soap, you actually wash the virus away. And for us, this has been a good opportunity for us as public health practitioners, because we realize, okay, so we can control COVID-19 by hand washing. That is so simple. But then we realize, oh, okay, so it is so hard, because people are not deliberately thinking about it. Okay, so we are giving you this information and strengthening it for your workplace, but then it means when you go back home, don't get out of your car, lock up your car, and then you're just jumping to grab your son and say, hey, how are you? How was your day? You've not washed your hands. You could actually take disease to your home. And I think for me, that is the scariest part. So as a workplace, remember, we are talking about ourselves as employees, as a family, but then also as in terms of our customers and our suppliers and etc. Okay? So if your customer comes in, you're like, hey, how are you, ma'am? How was your day? Please sanitize. Just helping them to do that may save them and save you at the same time. So being aware about that, you may not be the receptionist, but if you're getting out and you see somebody coming in, yes, ma'am, how may we help you today? Yes, oh, please sanitize. You get it? So you're saying it even if it's not your job, but you're encouraging everybody, you're telling everybody, and you're being responsible for your workplace, because if you don't protect your workplace, somebody could come in and bring in infection. Okay, so the respiratory hygiene is very, very important. As we realize, this virus is not like our measles virus, which moves in the air, but this moves through the droplets. As I speak and I spit out the saliva, the droplets carry the virus. They will stay suspended, but with gravity, they will have to come and settle down. For our human resources, for health, you need to be able to track your employees who came in today and who did not. Because the one who did not may be out there because they are sick. And please allow them to be off if they are sick. Before, when things were normal, if you don't show up to work because you're sick, I would have to ask so many questions and even probably tell you to come and show yourself to me to prove that you're sick. Maybe, maybe not. But the point here is that if you're sick, if anybody is sick, encourage them to stay at home and immediately inform your employer or health provider of any sick employees. So those go together. Okay? And of course, avoiding unnecessary travel within the country and practicing prevention measures of screening and isolation upon return. And I think our president has made our lives easier. He just grounded all the planes. No one can, fly out. Nobody can fly in. For now, you may need to suspend your travels and stay safe. And if you do travel, as a workplace, we may have to say no. Stay away until the 14 days are over for your self-isolation. So that is important. So this helps us prevent our workplaces from being breeding grounds of grounds for amplification of COVID-19. We have some examples of some PPE that you should have within your healthcare setting. That means that you're going to change your way of using them and try to use them sparingly. You don't have to be in a face mask the whole day. That is not the science. The science does not prove that one of the control measures for you to prevent is walking around in a face mask. Yes, it is not. The science doesn't show. Unless you're dealing with one uninfected person or for you have been infected. But otherwise, continuously hand washing and of course keeping the 3 feet, 1 meter, 3 feet away so that as I speak, the virus droplets don't land on you, because it's possible. You use social distancing and you continuously wash your hands, you can actually protect yourself. So that means that the little supplies you have here at City Medicals, you can use them sparingly, okay? Or you can devise means of how to use them sparingly. That way you don't consume the little supply that you have. Stephen, did you hear the question?
Hello?
Yes, so there's a question here from our director that is asking, how do you disinfect PPE like the N95? Is there a way you can use it sparingly, disinfect it, use it for not just for one time, but multiple times? What is the guidance like from WHO and CDC? Do you have any ideas?
Mm-hmm. All right, so about disinfection of PPE.
Louder. I can't get
about
it.
Disinfection of PPE.
Yes.
We know that some PPE is single use,
mm-hmm.
and we know that some other types of PPE can be used multiple times.
Yes. If the Ministry of Health guidelines say N95 is not among those, what can we do to use the available masks sparingly? Which sort of risk dynamics should we apply, or a model of risk assessment should we apply? Any ideas from WHO? I need to structure you so that, yeah.
Yeah, so even if you're in a healthcare setting,
Yes.
you all don't need to use N95 masks.
Yes.
I know many of the colleagues around there are aware that N95 is appropriate where there are aerosolization processes.
Okay.
And I know Dr. Hamilton can explain.
Aerosolization process. Okay. Okay, let me. So what he says that currently there are some guidance from USA that for them you can reuse the N95 if you do disinfect it, wash it, dry it up. But the Ministry of Health guidelines of Uganda have not indicated that N95 is among those masks. They're encouraging use by spare the use of N95 only in times when you're doing aerosolization procedures that require aerosolization, probably when you're putting a patient, I think, on oxygen or putting them on a ventilator or something, procedures that will require the increase high risk procedures. So they are saying that now use the normal surgical masks for other procedures for people who are in the healthcare setting.
I know there are all these guidances on how to use the PPEs, but people don't seem to feel contented with the guideline. For example, we are doing it's not contact tracing. We are doing follow-up for travelers who have come in the country from high-risk areas as part of the emergency response to check on them, and we are doing a daily check, temperature, and also doing symptomatic screening. Now, what sort of PPE should we have when we are interacting with such clients? They don't have any symptoms, but they have traveled from high-risk areas and they are under self-quarantine. Of course, the WHO says, if, like Doreen was saying, do social distancing, you don't need a respiratory mask. Okay, we are saying, okay, but still we need to be sure. Okay, if we are put on respiratory mask, do we use the surgical mask, do we use N95? Yes, N95 is a high specification respiratory mask. Do we dispose it? Especially looking at the scarcity of supplies. What is your experience? What are you guys as Minister of Health, especially what are you telling the health workers?
As a member of the IPC Case Management Committee, we are following WHO guidelines on the use of PPEs. You know, there have been a lot of misuse of these PPEs. We have been moving around Kampala to find
N95. I'm seeing people in the garages with N95.
On border with N95. But N95 is supposed to be used at the triage or screening area. And this surgical mask should be given to a suspected case. When someone is suspected, by using our case definition. I know the case definition is now changing.
Yes.
It's changing, or it has been changing since December last year. But the one we have, I don't know whether you have received it, the one from the Ministry of Health. So if someone fitting the case definition is given the surgical mask. Okay? But for the healthcare worker, you are supposed to put on the N95 at the triage and the screening area. But when you are interacting with someone who has been in Dubai, in China, whatever, in those risk countries, and is not symptomatic, social distancing is very important. Social distancing is very important, and you as a healthcare worker, you should do risk assessment on which PPE you should put on. If you see there is high risk, that this person is really symptomatic. You know what is funny? As I told you, the case definition is changing. You may find that someone is not presenting with the respiratory symptoms, signs and symptoms, and is presenting with fever and is for what? It's for trouble. So you have to protect. The most important thing is to protect your face. But not misusing PPEs.
In relation to IPC,
No.
But it is a single use.
Okay.
You have to dispose it.
All right.
This is A95. We have two types of A95. We have this cup shaped and another one which is cone shaped. But this one is better because it anchors very well. So when you see this metallic thing, it means it's towards the what? The nose. You just get these strings. Whether you are left-handed or right-handed, use your hand and you put it here. You get the lower strip. This is the lower strip, this one. Below the what? Below the ears. And this one up. So that it can anchor very well. You don't want to put them all above the what? The ear. Because anything can happen and they what? They come out. Then you organize this depending on the size of the what? The nose. Now that mine is small, okay? Then you can use it, but it is uncomfortable. But you can imagine you can't use it the whole day, isn't it? But if you are within the hospital or the screening area, you can always relax yourself after seeing after screening, then you put it back. Okay? Put it back while working. But you can't reuse it the following day. Because after date is now contaminated. It's contaminated in and out. Inside and out and out. Then removing it. We have had so many guidelines on removing this, but remember now the hands are contaminated. The hands are contaminated. When you are using gloves and you are using also this, we remove this before we remove the glove. But we decontaminate our gloves with 0.5 chlorine after. You clean your glove hands with 0.5, not 0.0, but 0.5, which is used to disinfect surfaces. Then you can get.
Can you sanitize if you don't have 0.5?
You can sanitize
After removing
the glove. Then you can take this, okay? You can take this out of the what? Yes. And then get this one. Or you get this and lower. Okay? You leave it there. Then you go for this one. Pull up and outwards. Then this one goes down and you dispose of. This business of the raw one goes first. Then this one comes up. Business of struggling with this masking should be what? Because in the process of struggling with it, you can create aerosols from here when this one is contaminated. Then as you struggle, you are creating aerosols and you are inhaling them. Or in the process of struggling, you create droplets and then you contaminate your eyes or mouth. Okay? Yeah. So the best way is to handle the strips very well. Okay? Put on and then look for it. After cleaning, look for it. Okay? Then look for this one up. This is our frame. We've been using this one. Been using this one. And it is very simple. This one is used especially in the we normally use this one anyway. This one should only be used when you are handling TB cases and highly infectious, Ebola, Marburg, other viral hemorrhagic fevers, and now COVID. Influenza, SARS, MERS. But we normally use this. This one is more expensive than the surgical. Okay? And the surgical just disengage the what?
Everyone at the workplace should know all the signs of COVID-19. Your colleague will come and present with them, and if you're not aware, you won't even know that your colleague is sick. As a workplace, you must put in place some temporary space that you can turn into an isolation unit. We've been asking this of many of the workplaces. It's a lot of work, but you need to do it. Because should I be at a workplace and I present with those flu-like symptoms or the COVID-19 symptoms, you should be able to put me in one place, isolate me, as you're either picking samples or as you're monitoring me to see. Because that's what they did at Entebbe. The gentleman had high temperature. They first put him aside and then said, after 30 minutes, let's check again. No, your temperature is still high. So it was not just your metabolism of being excited coming out of the plane. Now let us take you to an isolation place. Okay, and of course, quickly notifying the health authorities about employees presenting with suggestive COVID-19 signs, especially if they have a history of travel contact with a confirmed COVID-19 case. Briefly about how to safeguard our businesses against COVID-19, we have learned that when you institute and communicate measures that reflect your commitment to safety of customers and employees, people have confidence within the workplace. So for example, if I walk in and I see those banners at reception, if I'm a customer, I'm thinking, okay, so this place is taking my health seriously. They are actually thinking about this and they are paying attention on how we can prevent, how we can control, how we can detect COVID-19. So we believe that increasingly, let's communicate to our customers and our suppliers. Send that email to all your suppliers that as we go through this trying time, we are doing A, B, C, D to keep you informed and to keep our place safe so that we continue to do business with you. So we've realized that when people have confidence in your workplace, they stay in touch. So even just walking at the entrance and I see hand sanitizer at the entrance, even before I enter at reception. There's one at reception, but even before I could enter, there was sanitizer. So I was thinking, okay, people are aware about this. When we are coming in with the car, the guard first stopped us and brought hand sanitizer before we could even greet. And we thought that this is very, very important. So even the guard is aware. Everybody should be aware. Develop a plan for evacuating any suspects. We have talked about it before as an early warning system, but it's one thing to detect the case, but if you don't manage it well, another person could be infected. So I don't know, do you do any outpatients here? Any outpatient work here? Because somebody could come to outpatient department normally thinking it's malaria, but then when you do the screening as a doctor or a clinical officer, there's something suggestive of COVID-19. So if that is true, the plan that you have in isolating and evacuating could mean that you could infect yourself or you could infect more people. You need to do a contingency plan. So really, all those steps that you have to go through to anticipate if COVID-19 came, what does that mean to us? Then what would we do? And what do we do to mitigate the negative impacts? You need to start thinking about that within our different departments, our different sectors. We need a contingency plan because it could come to the point where we say we actually need to lock down. This is how COVID-19 will likely affect your business. Workers may become less productive if they fall sick. So in your contingency plan, start to think about it that way. If you woke up and half of your workers, one of them gets sick, now the others become contacts. Or maybe all of us become contacts. God forbid. So you're having like 30 people under quarantine. Our business may become less profitable. Demand can significantly reduce. It is happening. Okay, demand can significantly reduce because of the dynamics. You might decide to temporarily lay off some staff. And if you can't have staff, you cannot work, they are not productive, you can't be profitable. Okay? You may decide to temporarily close your business. And in terms of the suppliers, they may become less efficient. You were talking about it. You can no longer promise supply in days. You're talking about weeks. Some of them say, after the 32 days, that's when I can really promise anything, because everything is unpredictable. Develop your preparedness and response plan. Prepare and implement the basic infection and prevention measures. We've talked about those. Develop policies and procedures for identification and isolation. These are at strategic level. These are really strategic level decisions. Develop and implement and communicate about the workplace flexibilities and protections. If you're sick, don't come to work. Inform us. If your person is sick at home that has COVID-like symptoms and you're not sure, please don't come to work, but inform us. So you're going to have to be a bit flexible. I don't know if your human resource manager is here. Okay? So trying to work around that, implementing workplace controls and follow guidelines instituted by Ministry of Health. I know I've said a lot, but just remember this at the end of the day. The action planning tool as a management tool, where you say, this is our goal, and these are the actionable, tangible actions we are going to implement within this time frame. I encourage you to use it if you don't have any other tools that you use as an organization for your planning, but the action planning tool is very important. It makes you think about the actionable items. So the question is not whether COVID-19 will have a toll on your business or not. It is actually going to have a toll on your business. It's no longer a question. So putting the recommendation in place will dictate the extent to which the business will be affected. So if you put IPC and control infection, it means that none of you will get sick, none of you will have to stay at home, all of you will stay productive. You will stay productive for your business, but then also for your homes. So that's what it may mean. So it's no longer a question of whether it's going to affect you or not, but what can you do at your level within your capacity. So what we have discussed can constitute some sort of contingency plan for COVID-19. You can use those guiding points as your contingency plan. But then we are happy to work with you to develop a detailed contingency plan. I have a link here. It will take you to the OSHA.gov publication on how to develop a contingency plan. It is a CDC guideline, a very structured one. If you have the time and you can follow through it, it can actually get you to think about what engineering controls can I put, administrative controls, IPC controls. It is structured in that way. That way you can protect your business in a holistic way. So that's what we had to share with you in terms of your workplace safety, how you can protect your workplace, but also protect yourself in that sense. And we have the detailed modules. Okay, thank you so much.
On behalf of City Medicals and City Ambulance, we are two organizations, two in one. City Ambulance is an ambulance service provider. City Medicals, we are a healthcare provider. So we are two groups from City Medicals and City Ambulance. City Medicals also has a branch in Hoima, a hospital in Hoima called City Medicals Hoima. So we have members from City Medicals Hoima here who have joined us, headed by the administrator, Mr. Ham. So we are very privileged for Makerere to come here. You know, we've been talking about these things, but you know, human nature is that when you always listen from the same person, information tends to be not believed. So we decided to bring in our colleagues from Makerere. I know Dr. very well, I was with him in medical school, so that you can also hear from experts. And good enough, these guys are at the forefront of the fight for this disease, so they are more informed than us who are on the ground. So we thank you so much, and we are very grateful. We shall keep in touch. Yes. We want to keep engaging you, especially now that it's getting out of hand. And when we call on you, please respond. Yes. So thank you so much. Thank you. And I think we are more informed, right?
Yes.
We seem to be more comfortable. Okay? So have a nice day, and we keep safe.
Yes, keep safe.